Hello, my name is Professor Robert Thomas. I'm a consultant oncologist at Addenbrooke's Hospital, Cambridge University, as well as Bedford Hospital. In addition, I'm a professor of nutrition and exercise science at the University of Bedfordshire and medical editor for National World News. As well as being a mainstream oncologist, giving radiotherapy, hormone therapy, chemotherapy and biological treatments to patients mainly with prostate and breast cancer, I also lead a research unit which looks at lifestyle and self-help strategies and designs studies to show which work and which don't work and try to incorporate these into routine clinical practice. And I'm very pleased to be introducing a talk presenting some of this data to the Melton Mowbray Prostate Cancer Support Group. But it's about lifestyle strategies, which, the evidence behind them, which will support the journey through cancer to reduce many of the side effects and hopefully improve outcomes. So that's what I'm concentrating on tonight. So things we can sometimes do ourselves. But first of all, I'm not here to blame anyone or put a guilt onto anyone that, I didn't try hard enough, so my cancer's not responding or it's coming back. Because as you know, it's all about reducing the odds. You can be, that woman in the middle living a perfect life and get cancer at 29, or you can be that guy who's, gets to 90 and he just laughs in the face of the rest of us. But it's the odds are that if you do improve your lifestyle, if we manage to get everyone in the world to have, or in Britain to have a healthy lifestyle, probably you would, this is the CR UK data, you would reduce the cancer incidence by half. So the other half, doesn't matter what you do, you're going to get it. But, there's quite a big chunk of people who wouldn't get cancer if we all led perfect lives, which none of us do. We know the data suggests that if you are able to lead a healthy lifestyle, you will get a lower risk of getting cancer. But also once you've got cancer, the rate of progression will be slower. You respond better to treatments, your tolerance to treatments are better, so your quality of life is improved. And I'm just going to touch on, and the biggest thing which affected oncology was COVID in the last few years. So actually, that stopped people being diagnosed. It stopped them having surgery, for example, if you were waiting for surgery. So I'm going to just touch on a bit of that at the end, if you mind, and we'll hopefully have times for questions. So you think, well, lifestyle's pretty easy, isn't it? You have to get up in the morning, go for a run, take your vitamin D. But it's not actually on an individual basis. A lot of people are still struggling with this sort of confusion in the middle. What should you do? So what we've done as a cancer unit, which we've been doing for 30 years, this is not a new trend for us, is that we've set up a sort of integrated lifestyle unit which links to Bedford University, Cambridge, and universities across the world. And we look at the evidence which other people have published. We do our own trials, which I'll touch on tonight. Ultimately, we do double-blind randomized trials, which is the gold standard of research. And with that data, we publish in medical journals. We published over 100. Some of them are read, some of them aren't. We advise Macmillan and various charities on what should be in their information booklets. And we reach out to, this is more interesting, we reach out to groups like yourselves, who are, want to know what they should do. So, for example, we wrote something on cycling because there was an article that cyclists have an increased risk of prostate cancer. So that was the headline. If you actually read the paper, extreme cyclists had a slightly higher incidence of prostate cancer to intermediate cyclists. Both groups had a lower incidence of cancer than the general population, but the journalists forgot to mention that part. So we did a review, and obviously we published in Cycling Weekly, which is much more likely to be of interest to cycling than the BMJ. So we reach out to that, and obviously it updates my book, and we go on to TV things and spread the word. So where do we get the data from? This is where most of the data comes from. They're called cohort studies. And this is where you get, in this case, 42,000 people. You follow them for, say, 20 years, and you ask them questionnaires. You look at the incidence of cancer, and you correlate their lifestyle factors to whether they get cancer or not. So there's a lot of confounding factors, and that's why there's always a bit of a debate. But these are the things which are pretty well established now, and we'll talk about other things. But being a smoker, so none of this should be a surprise, increases risk of cancer. Being overweight, if you take vigorous exercise, it obviously reduces the risk. This is
specifically for prostate, by the way, but it also applies to most cancer. Lots of colourful vegetables, including whole tomatoes and things like that. Higher intake of fatty fish and reduced intake of processed meat. So those are the things nobody should be able to argue with. So they're pretty standard. But we're going to go on and talk about more interesting stuff. So first of all, starting with exercise. And there's lots of randomized trials, which are good quality studies of people with cancer, and they've looked at exercise program versus no exercise program. And don't forget, when we started all this business 20 years ago, most doctors would say, oh, don't be stupid, you should be resting, and it makes no difference. But there's a lot of data now that says you can reduce your anxiety, depression, fatigue, your overall quality of life goes up. One of the things I was involved with in Macmillan is if you exercised while you have your Zoladex injection or equivalent. And there was a very good trial showing you significantly reduce the incidence of metabolic syndrome, which is abdominal obesity, high triglycerides and high cholesterol. And we managed to get it as a nice recommendation now. So has anyone been started on Zoladex in the room? Yeah. So it actually is law, if you can call it law, that you should be referred to a 12-week exercise program the day you have your first injection to reduce the risk of these things happen. Did it happen? No, exactly. So it's fair enough getting the evidence and putting it in nice, but nobody polices it anyway, so it's not done. But I mean, individually, as a group, that's the best thing you can do. The day you have your injection is to just try and exercise as much as possible. I mean, you look pretty fit, so I think you do. Yeah. So if you do that, you don't tend to get the side effects. Well, you do get some side effects, but you don't get as many side effects. And more importantly, there's lots of data to say if you've had your primary treatment, say if you've been treated radically and with a prostatectomy or with a radiotherapy, that your instance of it coming back is 30% less if you exercise regularly. Up to about 3 hours a week seems to be the golden number. And that's not just prostate, it's bowel, breast. To an intensive exercise program or a mild exercise program or none at all. And the intense program people had much more cardiovascular fitness. They were less likely to get nausea, less likely to get peripheral neuropathy and fatigue. So there's no limit to the exercise you can do, apart from the fact it's very difficult and sometimes difficult to do. But no doctor should stop people exercising during chemotherapy, which they are still doing, unfortunately. Are men who'd had radiotherapy for prostate cancer, and we stratified them whether they exercised, smoked, if they were old or if they were overweight. And we correlated that against erectile dysfunction and pelvic symptoms. And the biggest correlate to late toxicity was whether you exercised or not. So now, certainly in our unit, we say if you're having radiotherapy, go on an exercise program. And we're very lucky. We've got a local university in Bedfordshire where their sports department take all our patients now for a supervised exercise program before they start their radiotherapy. One of our consultant oncologists in Cambridge never really ran before, and I think she heard one of my talks. She went over, tripped on a gravel path, broke her arm, and she was covered in scars on her face, so she didn't thank me. So you can injure yourself. And actually, it's a serious point, because if you have Zoladex or on treatment for prostate cancer, you lose your proximal muscles, which are your balance. So you have to be careful, because you could suddenly trip, fall over, break your arm. So there are some risks, and that's why it's best to sort of, I'll come on to ways. The other thing, when you exercise vigorously, for any of us, or you're not used to exercising, you do actually create these things called free radicals. I don't want to be too technical, but these are the things which damage your DNA. And if you damage your DNA, you can cause cancer and other chronic diseases. So that's why elite athletes are all ramming down the blackberries and the blueberries and things before they do an event to protect their DNA. So it's very important, if you are going to do an exercise program, to make sure you have lots and lots of anything colorful, or blueberries, blackberries, that sort of food, to upregulate your antioxidant enzymes, which protects your DNA. And that's why it's also important to graduate the exercise, because as you exercise, your antioxidant enzymes increase, but it takes time. So that's why you've got to do a little and then just increase it every time you do it. So, to have an exercise regime, you are allowed to be referred via the GP to a 12-week program, which is free. Or, if you've got a local gym, to have an exercise professional supervising you would be a good start. And do the exercise which suits you. So if you're worried about osteoporosis, you need to do weight-bearing exercise. If you're doing it for stress, you need to do more stress-related exercise. And if you're trying to lose weight, you need cardiovascular. So it's not, exercise isn't just one thing. I mean, as I said, 10 years ago, people just thought vitamin D was related to bone health. Now we realize vitamin D is related to lots of biochemical pathways in the body, not just looking after your bones. If you have low vitamin D, you're more likely to get dementia, cancer of the bowel, lung cancer, skin cancer, in fact, which is a bit of a paradox because you tell everyone to keep out of the sun to avoid skin cancer, but if you have low vitamin D, you're more likely to get it. So tell me what to do about that one. But in terms of prostate cancer, there has been a number of what we call meta-analysis, where you look at a big group of people, and it was very clear that for every 20 millimoles below a normal level, you have about a 5% increased risk of prostate cancer. So it is related. And if you're on active surveillance, because I'm sure the data applies to other types of prostate cancer, there's data now to show that you're more likely to progress and come off active surveillance if your vitamin D levels are low. So all the men I see on active surveillance, I say, make sure you get your vitamin D levels up to scratch. And how do you do that? Well, lots of food with vitamin D in, mushrooms, particularly if they've been in the sun, because mushrooms generate vitamin D in the sun like human skin, and there's oily fish, but only about 15% of vitamin D does come from food. It's hard to get the right amount. So obviously, if you can fly off to Lanzarote in December, that would be good, and just get some sun on your body without burning. Obviously, burning causes skin cancer. Tablets, the trouble is with tablets, there's been a number of studies, including one by Chris Parker in the Marsden, which gave up to 3,000 international units and measured vitamin D levels. And it didn't really, it changes a bit. So it is worth taking them, but it's not the only thing. And we're doing a COVID study, which I'll come on to in a minute, where we're measuring vitamin D. And it started in August and it's still going on. So we've had the very good opportunity of looking to see what happens to vitamin D between August and December, which of course is going to drop because there's no sun, and everybody's does drop. I mean, it was quite frightening. Most people in December were quite profoundly vitamin D deficient, except we can see it was a randomization between a placebo and a probiotic which has vitamin D in it. And the data is coming out now that if you have vitamin D with a probiotic, it's much more likely to be absorbed. And vice versa, vitamin D acts as a prebiotic to help the probiotic. So all good vitamin D supplements should ideally be with a probiotic, or try and get it measured. But we're not allowed to measure vitamin D in our area. I don't know if you are. If you go to the doctor and ask for it, they won't give it to you. But I can honestly say most of us are deficient, so we've got to do something proactively against it. At the beginning, processed meats. Now, I know it's Melton Mowbray, so I haven't got a pork pie in there. And my research manager says, actually, pork pies aren't as unhealthy as you think they are, because they're stewed and you've got the collagen around them and a lot of the fat has gone. So I'll put a pork pie in a healthy category. But things like which have got direct heat on them, and in fact, that is probably true because the meat is boiled, isn't it? It's not fried. So it's when you fry the meat and you burn it, these aromatic hydrocarbons are formed, and these are very, very carcinogenic. So if you're barbecuing something, clean all the black off first. There was a study from Maryland in America which said if you have a barbecue, in fact, it was a very nice study, half the group just ate a barbecue like that with burnt meat on its own, and they measured the amount of DNA breaks in their bloodstream, and they were very, very high. The other half, they marinated the meat in rosemary and herbs and spices. They par-cooked it in the oven and then just put it on the grill just to sort of give it a bit of a taste. And it was significantly lower. So you can still have your barbecue, but just be a bit more sensible and eat it with they call polyphenol-rich foods or vegetables and things, which act as the antidote. Because when you convert these aromatic hydrocarbons, when they go into the stomach and there's no vitamin C or polyphenols, they get converted into carcinogens. When you eat them with these foods, they actually get converted into nitrous oxide. And nitrous oxide is very good for you. It drops your blood pressure. It helps to feed the cells. So you can still eat what you want, but you just got to be more sensible around it. And the problem is these foods are not only carcinogenic, they're pro-inflammatory. They create an excess inflammation in our body. Now, we need inflammation to protect us from viruses and things, but we don't need our inflammatory processes to be running at full pelt every single day, which they generally are in the Western society. So the things which promote inflammation would be obesity, processed sugar, smoking, and that sort of thing. And things which are anti-inflammatory are exercise, nuts, very good anti-inflammatory foods, healthy bacteria, and polyphenol-rich foods, which I'll come on to. But this is the life of a researcher. This took us 12 years, this study, and it started because this guy in Minneapolis did a trial which said tea increases the risk of cancer. And we decided that that wasn't correct, but we can't just say these things. So we then did a 12-year study involving 44,000 people. It took 3 years to analyze, and I don't know for the life of me why we did this. Maybe I'm a bit stubborn. And we managed to show that if you have more than 3 or 4 cups a day, you have a 2% lower risk of prostate cancer. There we are. He was wrong, and I was right. Everyone just goes, so what? We knew that anyway. But and broccoli, of course, is healthy. We showed that as well. But I mean, anyway, but that's what it takes to show these things. I mean, you have to cross-examine it against smoking. And anyway, so if you enjoy tea, please carry on. Being overweight, we know that's bad, but it's trying to lose weight, especially if you're on hormones and things. Everyone gains weight. And it's not as simple as just reducing the calories. You could be affected by your mood, your education, cultural issues, your hormonal status, disability, or gut health. So it's not as easy as saying you need to lose weight. So the 3 tips I normally say, based on the evidence, is this is a nice study from Denmark, which showed that if you fasted for 13 hours overnight, which isn't that bad, this was actually involving breast cancer ladies, but the same applies. You had lower levels of this thing called glycosylated hemoglobin, which is a marker of diabetes, lower levels of inflammation, which we want. And in this case, it was a 36% reduced risk of their breast cancer coming back. So I'm pretty sure that would apply to prostate as well. So you just have your evening meal at 7, try not to snack until you go to bed, and start the morning without sugar-related foods. And if you can go for a brisk walk at the end of the fast, that's even better, because biologically it extends it by about 3 or 4 hours. So, for example, if you don't want to do it overnight, if you have your breakfast at, say, 7:30, and then you don't have anything till, say, 1:30, and then you go for a brisk walk or a run or something, it's equivalent to a much longer fast. And exercise, I've said, and processed sugar. Now, okay, I seem to have missed out the slides. So anyway, so the reason why processed sugar is bad is it feeds the unhealthy bacteria in your gut. So the healthy bacteria actually prefer fiber, polyphenols, fruit, vegetables, whereas the unhealthy bacteria love sugar. And when you put sugar in, they grow like wildfire. So you're altering your gut health. The other thing it does is that you get a sugar spike when you have, especially on an empty stomach, your insulin levels go up to compensate, thinking there's a big meal, and cancer cells have insulin receptors on them. So the higher the insulin levels in your body, the more likely they are to be driven to grow faster. And that's one reason why type 2 diabetes, which has very high insulin levels, is correlated with increased cancer risk. And the other thing is there's lots of calories in sugar, but you get hungry half an hour later because it's metabolized so quickly, because you get a dip in your sugars, you get fatigue, you get low mood, you get demotivation, and then you just reach out and have some more sugar. So your overall glycemic load, the amount of calories you eat, is significantly greater. So whole food supplements, so turmeric, for example, is a whole food, isn't it? And it's put into a capsule. You can get, anything can be dried and put into a capsule. So that's really just a concentrated food. Or there's supplements where they extract a chemical, like a vitamin or a mineral, and put it into a capsule. And that's, but it's not really a drug, but it's much more less natural, for example. So let's start with fish oils. Now, I took fish oils religiously for 5 or 6 years. Because we do need more omega-3 in our diets. We're quite deficient in omega-3, and we know this from a test we used to do. No longer do it. But so, you think fish oil is a good thing to do. Except there were 2 studies in prostate cancer. I won't bore you with the details. Oh, no, so this slide shows that if you have oily fish, you're less likely to get prostate cancer. We've said that. So you think, well, that's good. But then these studies, there was one from Japan showed that if men who had a high fish intake actually had an increased risk of cancer. And then these 2 studies, the SELECT study, prostate prevention study, both showed that people who took fish oils had an increased risk of prostate cancer. So it doesn't seem to correlate. We need more omega-3, so you need to find it with fresh oily fish and vegetables with flax seeds and chia seeds, things like that. But taking a fish oil, and I rang this guy Brasky actually, and I said, "Are you sure it's not because of the vitamin E, which is a preservative in fish oils?" And he said he couldn't answer that. And the reason is in this study called the SELECT study, which showed that people who took vitamin E and selenium had an increased risk of prostate cancer. It was in that study they did a sub-analysis and found that fish oils were bad. But I said, well, did you check that in the placebo group there was no increased risk? And he said, no, he just looked at the group as a whole. So one possibility why fish oils aren't good is that they're preserved in vitamin E, which isn't good for you. I don't know. And they do tend to go off. And when they go off, the oils become quite rancid, especially being kept in the light. So I'm not saying don't take them once or twice a week, which is probably okay, but don't take them high doses or regularly, and make sure they're completely fresh and being kept in the dark. And if you can get one without vitamin D as a preservative, even better. And these are the studies looking at vitamins. Now, we've all been told that vitamins are good, and of course they are good, but when you put them into a supplement, these 2 studies from Scandinavia showed that vitamin A actually, these were people who had lung cancer and head and neck cancers, and they were given vitamin A or a placebo. They had to stop the studies because the cancer risk was increased. The same applied to the vitamin E trials, that they increase the risk of cancer because they're direct antioxidants. And even though foods like turmeric, etc., are antioxidant, they're not direct antioxidant. They just tell your body to upregulate the antioxidant pathways. So in other words, they tell your body to do more of what it's good at rather than try to steamroll it and be direct antioxidant. And that's the theory. So when you read the Daily Mail, and every 6 months they do the same headline, they just roll it out when there's, one of the royals hasn't been caught doing something. And they always say, vitamins cause cancer. And ring them up and you say, no, it's not vitamins cause cancer. It's specifically vitamin A and vitamin E causes cancer, and they're only laboratory studies anyway, so it's probably safe to take a multivitamin, but not recommended. To estrogenic foods, when you put them into pills, they start behaving too much. There's too much hormonal effect in them, and there are studies which shows it can actually start increasing proteins which can drive cancer. So whole soy is great, and phytoestrogenic foods is great, but when you put soya things into, and the same with saw palmetto, which is the most commonly taken supplement in prostate cancer in the world, promoted directly to. There was a very early study from 20 years ago which said there might be a benefit. When the a very large organization in America, the largest cancer organization, did a double-blind randomized trial, there was no benefit. But of course, the makers of saw palmetto don't tell you that trial. They just refer to the one 20 years before. But anyway, what can you do? So I've already mentioned the phytoestrogens, and there's what annoys me is that some supplement makers are just putting, just randomly, without any data, despite knowing the data that phytoestrogenic food could promote cancer, they're putting things like clover and spearmint and things which are very phytoestrogenic into supplements, and nobody stops them. And they're free, you can see them, they're all over the place. So coming on to polyphenols, which I've meant, these are the chemicals in foods which give it its color, taste, and smell, a bit like lycopene, and they have enormous health benefits. And they have health benefits for a number of reasons. They reduce inflammation, excess inflammation. They help the genes we've been born with. So, for example, the Angelina Jolie BRCA1, BRCA2, which is mutated, they can help upregulate those genes, even if they're partially mutated. They are prebiotics to gut bacteria, so they help promote the healthy bacteria. They slow the transport of food, of glucose across the gut wall. So that's why one of the reasons why fruit doesn't cause diabetes when they're quite sweet, because it actually slows the glycemic index, slows the transport of. So that's good. And they have direct anti-cancer properties. And they can upregulate antioxidant enzymes without being direct antioxidants, like vitamin A and vitamin E. So one of the things I was lucky enough to be invited on was a committee, for want of a better word, run by the NCRN, which is the Council for Organising Trials. And they said, look, there's a lot of people taking supplements. We know there's some data against them. Some might be beneficial. So what do you think about forming a group and trying to find out if there's any which could work? And you've already mentioned the name, so I'm not going to, but this is the background behind it. And we sort of sat down with towels on our head for looking at the animal data, the human data, and we came up with these 4 foods which seem to have the best evidence for prostate cancer. And they work in slightly different ways. One helps epigenetics, one helps gut health. There's no point having sort of ginger and turmeric in the same supplement because it's sort of the same thing, really, or having beetroot. Beetroot is one of the things we thought about, actually. So anyway, we formed, it was a government committee, so this didn't exist, so we formed a supplement based on that, and we decided to do a double-blind randomized trial, which half the people had it, half had placebo. We're very pleased to see there was a difference in PSA progression. Then later, because we presented it in ASCO, which is a large cancer organization, they said, well, are you sure it's not just affecting PSA, not the underlying disease? Well, we specifically did not choose phytoestrogenic foods, which can affect the PSA. These foods don't. But nevertheless, we did a subsequent trial where we looked at the changes on MRI scan, and there was a strong correlation between people whose scans stayed the same or dropped in the group which had the supplement. So there wasn't a situation where the PSA had gone down and the MRI looked worse, for example. And we're very pleased that the Institute in America was very, very strict on these things. If you Google food for prostate cancer, our trial comes number 1, which was quite a privilege, I think. And it shows that the trial was conducted properly. So a lot of these people say, well, there's a conspiracy theory against healthy foods and non-drugs. It's not actually true. If you conduct a study properly and it's externally audited, they do acknowledge it. It's just that most of the studies aren't very well done. And this is not our study. This was a study from Japan who took the supplement and gave it to people it was actually mainly women in this, and they looked at people who had hormonal type side effects, so things which affect you if you've got Zoladex, or women going through menopause. And they also showed an improvement, mainly with joint pains and hot flushes and things. So that was quite rewarding. One of the things the committee did was look if anyone's had Taxotere chemotherapy. That's something given for prostate cancer, but also breast and lung. And this damage can happen. And as we now then started working with some very clever people around Britain, including a team in Nottingham, we looked at a topical polyphenol-rich essential oils to see if it would reduce side effects. And virtually eliminated a very common side effect of chemotherapy, all completely natural or freely available. So we got involved in other sort of studies, but that was also very rewarding. If you have bad gut health, you're more likely to get bloating, flatulence, get fatigued. You actually, it thins the gut wall. So you're more likely to get ulcers, indigestion, have to take omeprazole, get heartburn. And the reason is when you have a thinning of the gut wall, you get toxins then leaking into your bloodstream, which shouldn't have leaked in, and you get nutrients leaking out. So you actually lose minerals, which you need for your body's hormones. Now, when these toxins come into your body, it sets up an inflammatory response. So not only do you get inflammation in your gut with bad bacteria, your body's immunity attacks them and it increases inflammation. And a byproduct of the attack on these toxins is that it can also then damage your joints, damage your brain, damage your pancreas, to get diabetes. And so this is the problem with poor gut health. And there's, not surprisingly, lots and lots of diseases now linked to chronic poor gut health. Not only in the gut, so more likely to get food intolerance, inflammatory bowel disease, and cancer. You're more likely to get systemic diseases, all of which are now more common with the treatments you give to prostate cancer. So you're more likely to have high cholesterol, weight gain, osteoporosis, and those sort of things. So it's very important. So, and the problem, well, I'll just diverse it a minute. The other thing we did when doing lockdown to keep us occupied, because we had to stop all our cancer studies, we started doing some COVID studies, and it became very clear that people who had worse COVID symptoms there's a correlation between poor gut health. And that's now been published very, very extensively, that it was a major risk factor to COVID and ending up on a ventilator. And what they found is in your lungs, when they do aspirates of people with severe COVID, you are finding bacteria which had migrated from your gut into the lungs and increase the inflammatory response, which is ultimately the fatal thing for COVID. Anyway, so I just digressed a bit. So how can we look after our gut? Reduce sugar, exercise improves gut health, burnt meat, all the things I've already mentioned affect your gut. But you've got to try to eat, we've all got to try and eat some probiotic-rich food. So kimchi, sauerkraut, mature cheeses, to try to have every day something with some healthy bacteria, which we're not very good at in the British diet, are we? It's not like Korea where you have kimchi for breakfast and things. This is nattu. It's got lots of bacteria, but it tastes horrible. So I wouldn't. We can try it, but and then then the prebiotics. These are the things which feed the bacteria, and they're just as important. Things like inulin, or anything in beans, mushrooms, fruit, and they work by. There's two types: fermented soluble fibers and prebiotic polyphenols. They work by feeding the healthy bacteria. So it's a combination of those. Does a supplement work? Well, there are many situations where a probiotic supplement is healthy. So if you're traveling, if you've had antibiotics, if you've been in hospital, it supports vitamin D absorption, during COVID. So, but if you have a healthy gut, probably they don't make any difference. But most of us don't have a particularly healthy gut. Just digressing a little bit, one of the studies called the Zoe app, I don't know if you're familiar with, where they showed, this was a large study just at the end of lockdown. They showed that people who took probiotics actually, or vitamin D, had a lower risk of getting COVID. So there was some correlation. A randomized study involving 150 people with COVID, particularly long COVID, and we randomized the probiotic plus or minus a pommy tea-like thing, with lots of herbs and spices. And we saw a very significant reduction in fatigue, improvement in sleep, and particularly improvement in gut symptoms, which can be related to COVID. So there's another incident, there's another situation that people recovering from COVID could they do benefit significantly from improving their gut health even further. But that's the COVID aggressive. But actually, coming back to cancer, what has been recently discovered is if you have poor gut health, you do not respond as well to cancer treatments, particularly the new biological treatments. Now, in prostate cancer, there's not many of these new well, they are coming through actually, like Pembro, which is a PD-L1 inhibitor, it's called. And what they do is they tell your body, they manage to uncloak the cancer cell. So the reason why cancer cells grow in your body is because your immunity doesn't recognize them as foreign. Well, not at this stage. They do in the early stages, that we get cancer cells every day being formed, but once they've sort of got a foothold, they manage to escape the immunity. And what these do is they uncloak it, but it still needs your immunity to kill it. So if your immunity is running at half-mast, it doesn't kill it as well. So there's a 40% better response rate to these drugs if you have better gut health and if you've looked after yourself. And that's why drug companies are all over gut health at the moment. Suddenly it's become popular so there's a lot of data suggesting now that the change in your gut health could be a trigger to androgen resistance. So as we used to doing studies, we thought, well, that'd be an easy study to do. And this is the one which is just going through ethics at the moment, where both groups, we can't not give a phytochemical-rich supplement in a trial anymore because everyone's going to take it anyway. So what we're doing, we're giving, we're trying to have a 2 placebo group. We're not sure if we'll get away with that because I think if we try to consent someone to say they're going to be on 2 placebos, they'll probably say no to entering the trial. That's the aim so far, and it's just going through ethics. So they'll have a phytochemical-rich supplement, and they're randomized then to a probiotic or not, and we're going to follow symptoms and also PSA. And that will be the first trial in the world to see if a probiotic added to people with prostate cancer will reduce progression. And data, which I've just shown before, does suggest it would. So in the meantime, until we get the results, I would strongly emphasize improving your gut health if you can. Now, we're going to actually use a supercharged pommy for the want of a better word, where we're actually going to add a bit of black pepper. We're going to increase the dose of turmeric and pomegranate using, we're going to still have the benefit of the whole foods, but we are going to do extracts. So the actual polyphenols within turmeric will increase. So it'll be a higher dose basically. And we're going to add, we're probably going to either add resveratrol or cranberry and black pepper, which improves the bioavailability. So that's the one we're going to pick for the study.